Hello class, my name is Daniela Flores and I will be doing a presentation on Fibrodysplasia Ossificans Progressiva, also known as FOP. Let me begin by describing what Fibrodysplasia Ossificans Progressiva is. FOP was first discovered in the 17th century. Back then, it used to be called the Stoneman syndrome, given the stiffness and rigidity presented in patients. This condition is a disorder in which muscle tissue and connective tissue such as tendons and ligaments are gradually replaced by bone. In other words, bone develops in areas where it's not normally present in healthy individuals. The formation of this new ossified tissue occurs outside the skeleton, called extraskeletal or heterotopic bone, resulting in very constrained, painful, and nearly impossible movement. FOP generally becomes noticeable in early childhood, starting with the neck and shoulders and proceeding down the body and into the limbs, normally in that order. Flare-ups and new growths continue to occur throughout adolescence and into adulthood. Signs which point at this disorder can be found early in the development of a child. People with this rare condition are generally born with malformed big toes. This abnormality is a characteristic feature that helps to distinguish this disorder from other similar bone and muscle problems. As I mentioned earlier, one of the very devastating consequences of this disease is the inability to move. Extraskeletal bone formation causes progressive loss of mobility as the joints become affected. For instance, because of the extra bone, patients become unable to fully open their mouth, which causes difficulty in speaking and eating. Over time, patients experience malnutrition due to their eating impediment. They may also struggle breathing as the bone formation around the rib cage restricts the expansion of the lungs. Carriers of this disease are therefore very susceptible to respiratory problems, which in many cases is fatal. So what causes this very detrimental disorder? According to research, it stems from a mutation in the ACVR1 gene. This gene provides instructions for producing a protein called BMP. It is important to know that this protein is found in many tissues of the body, including skeletal muscle and cartilage. The mutation disrupts BMP pathways, altering its ability to control growth and development of the bones and muscles. The mutated gene also inhibits formation of the skeleton in the embryo and the repair after birth. As previously stated, this condition is caused by a genetic disruption. This condition is inherited in an autosomal dominant pattern, which basically means that one copy of the altered gene in each cell is sufficient to cause the disorder. Most cases of Fibrodysplasia ossificans progressiva result from new mutations in the gene. These cases occur in people with no history of the disorder in their family. In a very small number of cases, an affected person has inherited the mutation from one affected parent. As I said earlier, FOP is a very rare disorder, believed to occur in approximately 1 in 2 million people worldwide. Of an estimated 3,000 affected individuals, there are approximately 800 known patients. This can be attributed to many factors such as early death, lack of medical resources, and wrongful diagnosis. This disorder affects both genders equally and all ethnicities impartially. Unfortunately, there is no cure for FOP, and life expectancy for carriers tend to be relatively short. Life expectancy as of right now is around 40 years old for patients suffering with this condition. However, these are some precautions suggested to extend and improve quality of life. Avoid trauma, such as a fall or invasive medical procedures. This may trigger episodes of muscle swelling and inflammation, followed by more rapid ossification in the injured area. Avoid contact with other ill patients and exposed environments, as flare-ups may also be caused by viral illnesses such as influenza. Although there's no known cure, some treatments have made significant contributions in the life of patients suffering with this condition. For instance, certain types of drugs are used to relieve swelling and pain, such as corticosteroids and non-steroidal anti-inflammatory medication used between episodes. Affected individuals can also benefit greatly from occupational therapy. In many cases, OTs will recommend special braces, shoes, and other devices that assist in walking and weight bearing. Other form of treatment is supportive. Genetic counseling may be useful for families with the hereditary form of FOP. So with everything said, there's still a lot to learn from this genetic disorder, and it is crucial that medicine and technology work together to provide a better outcome for people with FOP. Currently, clinical trials are being conducted, as well as other forms of genetic testing and research studies. Thank you. This concludes my presentation.